Manchin, you're up.
Hey, Coach, thank you. I appreciate that.
You're welcome.
Dr. Carroll, with our older veteran population increasingly becoming disconnected from the communities over the pandemic, especially in rural areas such as mine in West Virginia, they've lost the majority of their support networks. Just 2 months ago, we had a 70-year-old who committed suicide in the parking lot of the VA, which is unbelievable. So how are we tailoring outreach and care for older veterans?
Senator.
Dr. Carroll?
Oh.
Yeah, Mr. Chairman, may I respond?
Yeah, anybody. There we go. Jump right in there.
Thank you, sir, for the question. And Dr. Smith, Dr. Miller, since I was called upon, I'll kick it off, but you're welcome to join. Thank you, sir. We are trying to tailor our outreach, our services in mental health and suicide prevention to all veterans, but to do it by groups, whether it's demographic groups, whether it's based upon age, whether it's based upon diagnosis or service status, whatever it is. Our outreach and to the point of your question, I think that's probably the most critical piece.
Yeah.
So our outreach campaigns are tailored to different age groups, and we try and reach them through different means and resources. Our Make the Connection website has stories of veterans telling what they've done to move forward in their lives based upon age and based upon period of service.
Let me throw this one at you then, because I know our time's going to be short. Let me throw this at you. Many people in rural areas such as mine and the chairman's here in Montana don't have health care. Don't have internet service. I know telehealth has been a big thing. What do we do with those who don't have access or don't use the internet? How are you reaching out to them, making sure we're not missing somebody?
Yeah, through the communities, to the shortest answer, sir. I think, we are working to expand the reach of telehealth through broadband expansion, working with our VFW partners and other organizations who were with us in the first panel and otherwise. But I think trying to, through all of our suicide prevention activities, working with local communities. Okay. So promoting together with veterans programs and local communities, so it becomes more of a vet-to-veteran community-based program, recognizing the unique circumstances and the unique.
I have another question for you then, okay? Yeah. Speaking of the veterans being able to access the help they need, mental illness, health, and keeping them hopefully safe, we have a National Suicide Prevention Lifeline, the 800-273-8255. I don't know how many people can memorize that one. That's why we passed the 3-digit dialing code for a hotline, which won't start until July 16th, 2022. So how are we getting this information out that they have help just a phone call away? How are we pursuing that, or how are we getting it out to the general public?
Dr. Miller is on the panel here, sir.
Whoever can answer that, we appreciate it. We'll take anybody.
Yes, sir. We have a paid media campaign active right now, targeting Veterans Crisis Line services and informing veterans as well as those who love and support veterans regarding VCL and how to get in touch with us, whether it be telephone, whether it be text, or whether it be chat. The VCL paid media program is one of our most frequently utilized in terms of our statistics.
I got another question for
engagement.
You. Got another one for you. Thank you, Mr. Chairman. I appreciate you. This one here has to do with the veterans in the community, how they're overseeing non-VA care providers. This is about opiate. Opiate has been rampant throughout my state, the opiate addiction, and it's really hit my veteran population extremely hard. What we don't know, we can't follow to find out when they come to the VA where they've been before that and how we can follow. Are you all tying in, are you tied into the prescriptions from the drugs, all the drugs that have been prescribed throughout the state of mine, West Virginia, or any other state, so you don't overprescribe to a person who's already gotten their pills someplace else?
Yes.
Anybody?
Yes is
Senator
the answer.
Smith, the answer is yes. Our prescribers, our primary care providers are able to check the state databases for the prescribing of opiates.
Let me just say, to all, I thank you all. I know it's a tough job. I mean, there's so many, but we have so much need out there. And these are the people that basically was willing to give their life for us. And that's why we feel so passionate. I'll say this too. The veterans are still the glue that holds this country together. They hold us together in Washington. They really do. They bring Democrats and Republicans together. And thank God for our veterans and our service members that we have serving, because without them, I don't know if we'd be able to talk about much that we would agree on. But we do agree how special our veterans are, and that's why we just are so diligent and vigilant about the services that we're expected to give and that you all are doing, and we appreciate that, but we always need to do better. Thank you.
Thanks, Senator Manchin. Senator Bozeman, are you there?
Yes,